afternoon, ladies and gentlemen. Thank you for being with us. I'm going to ask Dr. Glynn just to take you through this week's data. So, Ronan, whenever you're ready.
Thanks, Tony. Good afternoon, everybody. This afternoon we're reporting 2,975 new cases of COVID-19, bringing our 14-day incidence to 952 per 100,000 population. And you can see there in the top line that our 7-day average of cases has doubled over the past fortnight, and indeed is 3 times higher than it was at the October peak in 2020. Unfortunately, whilst we had seen a transient stabilisation in the numbers in hospital at the end of last week, over the past couple of days we've seen an increase again, and we now have 551 inpatients with COVID-19, and we are running at an average of somewhere between 57 and 60 admissions per day, with 73 in the last 24 hours. We currently have 89 people in ICU, with 11 admissions in the past 24 hours. So you've seen this line graph before, and essentially what it shows is the 7-day rolling average of cases. And what you're seeing is that the current very high incidence that we're experiencing took off from about the last week in September, with a further significant acceleration in incidence from the last week of October. Unfortunately, given the very high numbers of cases that we reported last week, that last week basically was the third highest case count for the pandemic to date, with almost 25,000 cases reported in a single week. As I said, only 2 weeks prior to this have reported a higher number of cases, and that was weeks 1 and 2 of 2021, last January. Unfortunately, we're seeing a deterioration in incidence across all counties, and you can see there that Leitrim, Waterford, Carlow, Louth, Laois, Longford, Westmeath, Donegal, Cork and Kerry all have 14-day incidences of more than 1,000 per 100,000 cases. And again, we're seeing significant increases in incidence across almost all age groups, with a particularly marked and sharp increase in those aged 19 to 24. And incidence in that age group has increased almost threefold over the last 2 weeks. We've seen significant increases, unfortunately, as well, however, across all age groups aged 13 years and older. One piece of good news today is that we can now see concrete effects, positive benefits of the booster programme. So you can see that the 2 lower lines on the graph there in purple are for those aged 80 to 84 and those aged 85 plus. By about the 11th of October, 50% of those aged 80 years and older would have received a booster vaccine, and you can see at that point that there's a marked change in the trajectory of incidence for those aged 80 and older, and they've departed from the patterns that we're seeing in all other adult age groups. You can see for those aged 75 to 79 that unfortunately incidence is continuing to increase in that age group, and that's obviously a concern. And I guess what we'd say at this point is that just 20% of people in that age group have been boosted. But obviously we would be hopeful and optimistic that as soon as these people are boosted and come forward for boosting, that we'll see the same very positive beneficial effects of boosting that we've seen in those aged 80 years and older. Unfortunately, we're continuing to see, despite very, very significant levels of PCR testing over the past week, we're continuing to see increases in positivity rate, with positivity rates in the community now between 17 and 18%. And the dotted red line at the bottom there is positivity rates in our acute hospital laboratories. And again, unfortunately, that's continuing to increase and is now running at about 6% of cases. We're seeing increasing positivity across all age groups, but again, most marked and particularly marked in those aged 19 to 24 years. And unfortunately, all of this is translating into, as I said, increasing cases in our acute hospital system, with 551 cases and an average of 60 admissions per day when today's data is taken into account. And as I said earlier, 89 people in ICU with 60 mechanically ventilated and an average now of 6 admissions per day. We're seeing about 150 deaths reported per month on average. And just to give you the up-to-date data, unfortunately over the past week we've had 74 new deaths reported, of which 44 were reported as having a date of death in November, 22 in October and 8 prior to October. Our growth rate, best estimate at the moment, is about 5% per day, but I would caveat there's a very significant uncertainty around that because of the midterm break and some changes in testing patterns over that time, and a reporting issue with cider on one day last week. So we'll obviously update on this next week, but uncertainty around that figure today. Just comparing ourselves then with member states across the European Union, and as you can see there, we're currently 8th. We've got the 8th highest 14-day incidence across the European Union, with a 57% increase in our 14-day incidence in the past fortnight compared to the previous fortnight. But you can see that the picture across the Union is very concerning, with just 3 countries, Latvia, the UK and Romania, reporting an improving picture. But of course, all 3 of those countries are reporting an improving picture off a very, very high level of disease. That concern then is reflected in comments from Hans Kluge, who's the Director for WHO Europe, in recent days, where he's noted that Europe once again is at the epicentre of the disease globally. Unfortunately, if we stay on this trajectory as a region, we could potentially see another 500,000 deaths by February. But the important point in that is that that's not inevitable. We can change the course of that, and by using basic mitigation measures, masks and all of the other tools that we're familiar with, we could prevent almost 200,000 of those deaths over the coming 2 to 3 months. Just a closer look, comparing ourselves with the UK, and you can see that whilst we were running for a very long period of time at an incidence level much lower than all of the other areas, you can see that over the past fortnight in particular, our incidence has taken off and is now higher than Wales, Northern Ireland, Scotland or England. Just briefly then, some ESRI data, looking at the number of contacts that people are reporting, and they're reporting that for anyone who has had a contact, that the average number of contacts for people has increased progressively over the past 9 months, to its highest level in October at 6.2 contacts on average. And then just looking at the issue of compliance and hospitality, and we have 2 different data sources for this today. So one is from the SRI data set, and what this is telling us is that approximately 1 in 3 people who are using pubs, cafes, restaurants are not being asked for their COVID cert. And you can see, if you just focus on the blue line for pubs there in the second chart, you can see that there's been a significant deterioration in that from September to October. And then that data is backed up by separate Amoric tracking survey, which again just asked people in the weekend just passed, so last Saturday and Sunday, if they'd been asked for their COVID cert when attending cafes, restaurants or pubs. And again, about 1 in 3 people are reporting not being asked for certificates. So situation analysis then, unfortunately, is that incidence is very high and increasing. Our cases have doubled over a very short period of time, and our 14-day incidence is now very high at 952 per 100,000. Unfortunately, test positivity is rising across all age groups. We're seeing significant rises in incidence across all adolescent and adult age groups, and this is being translated into high numbers in hospital and intensive care. On the positive side, however, we're seeing a very firm effect of booster vaccination in those aged 80 years and older, and we would hope to see that translate into an improved incidence in other age groups who are due for boosters over the coming weeks. All of that said, given the very high levels of socialisation that we're seeing and the force of infection, the future trajectory is very uncertain. There's no guarantees at all that the profile of the disease that we're reporting at the moment will change for the better over the weeks to come. And unfortunately, we still require individuals, institutions, organisations, all sectors to do what they can over the coming weeks to try and mitigate the worsening disease profile that we're reporting. Thank you very much.
Thanks very much indeed, Ronan. So we're now happy to take any questions you may have. So Fergal.
Yeah, good afternoon.
Afternoon.
Dr. Hoolan, are you seeing any sense of reduced socialisation given the messages that came from this table last week? In terms of the data we're just looking at there, and maybe also people's own eyes, doesn't seem to have improved, has it?
Straight answer to the question is no. We're not seeing encouraging signs of reduction in socialisation. We're still seeing high levels of socialisation right across the population. We understand that the message is a difficult one for people to both hear and to adhere to in the way in which they live lives. We've all become tired of the pandemic and we understand why that is. We still see quite a substantial amount of adherence to basic public health measures across the population. But we know that it's just not quite at the level that we need. And as I've said on many occasions, particularly over the last couple of weeks, that the really significant effect that we know we have from vaccination, together with that adherence to public health measures, is reducing likely transmission of this virus from an average, potentially, if there were no mitigation measures in place, of perhaps 6 to 8 cases resulting from each infected case, in other words, a reproductive number of 6 to 8, down to something in the region of less than 1.5, certainly 1.3, 1.4, which is where we are at the moment. So that's a significant amount of suppression. What the data in terms of the case numbers and the very concerning projection or acceleration of incidence you're seeing across almost all the age groups, other than those that are boosted, that's the thing that's giving us concern. And a small improvement in terms of our collective adherence, but across the entire population, might be sufficient to bring this back under control. We know, because we've got SAM data published from the ESRI, and I'm sure you're well familiar with what that data is saying, they look like small shifts in terms of the slippage by way of our self-reported adherence to guidance, the average number of contacts that we might be reporting. But those small changes, when our force of infection is so high, have there's an amplification effect, if you like, in terms of the numbers of cases. And so we're simply socialising at a level, in broad terms, that we simply can't sustain in terms of the numbers of case numbers. So our message would be to people, if you're planning, and we're advising people to plan with these guidances in place, the basic public health measures in place, look out over the next week, 2 weeks, think about the things that you're going to undertake by way of activities. We talked last week about the importance of reducing your discretionary contacts. I think a good message for people to hear would be that if you're planning to do something and meet up with other people, to try and reduce those contacts by half. And if each one of us was doing that, it would have a significant effect, we think, in terms of transmission. So if you're planning to go out 2 nights of the week, maybe just go out once. If you're planning to have 10 people over to the house for a particular event, maybe just have 5 during this period of very, very high transmission. Because the reality is the opportunity that's been given to the virus by the levels of socialisation to transmit from person to person are simply too many. And in particular, as we head into the time of year, and we all know, I mean, the Christmas lights are already up in many places in society. We're heading into a time when intergenerational socialisation is something that we'll all want to do. Families will want to meet up with one another. We need to do our best to do 2 things. One, get the level of socialisation down to have the impact on transmission that we'd like to see. But we know that's going to take time, even if we turn around our levels of socialisation. And 2, to get the booster programme rolled out and for people to get the message that if you're not vaccinated, come forward for vaccination. There are still pockets of people out there that are not adequately vaccinated. And then if it's time for your booster, to come forward for your booster, that's really important. And the data that Ronan has shown you here shows it's really good data that shows these boosters are really working very, very well. And they're working quickly for the people who receive them. So the protection comes in quickly, and the protection is very, very significant relative to all the people who have not yet received a booster. So if it's time for your booster, come forward, and it'll be really good for you to get that booster as soon as possible, particularly when you consider the time of the year that we're coming into.
And I know Professor Nolan's not here, and the Minister told us this morning that the modelling group's being asked to come up with fresh modelling for early next week. I think the last picture was probably what would happen we'd see a peak mid or late November and perhaps numbers tapering down. But I'm not sure, I didn't see an hour number there. I don't know whether, Dr. Glynn, you might have an hour number, maybe you don't today. But in terms of if these numbers are sustained, in terms of the socialisation we're seeing, if that's sustained and everything else being equal, a continued rise of cases in the weeks ahead?
We think if that's sustained, yes, that's what's likely to happen, yes. And so that's why we think it's really important for people to hear the message about the change in behaviour and the practical things that people might be able to do to become mindful, as I say, of the activities they're going to engage in, the contacts that they plan to have, not all of which are going to be discretionary, but to plan to reduce your discretionary contacts by half over the coming weeks. I think just in terms of the modelling, it is right to say that we will be doing updated modelling in the near future. One of the things in particular we'll be looking at is introducing into the models the assumptions around the waning immunity, because the models at the moment don't reflect that, and that will give us a clearer picture of what we think might happen over the coming weeks. We're not saying to you that we see a peak coming in November, and I think there might be a narrative out there that at some point, sometime later in this month, we will pass a peak. We're not saying that. And nobody should take comfort from that being the situation. We are, on the other hand, to be optimistic about things, saying that transmission is not inevitable, and that we hold it within our, if you like, our collective capacity to be able to prevent this infection from transmitting through the application of all the measures that we've applied in the past. And we're going to need to try to find a greater level of collective adherence to those kinds of measures if we're going to have an impact on transmission. If, as you rightly say, that doesn't happen, then it's hard for us to see how we're going to see an improved situation in terms of transmission in the coming weeks as we head into winter.
Professor Butler, can I just ask you, because I got a lot of emails, I'm sure many of my colleagues here do too, about people with underlying conditions, and we dealt with this before earlier in the year, and I know that a large number of patient organisations representing people with underlying conditions or even rare conditions have asked for, as soon as possible, that the booster vaccination programme be rolled out to those groups. They actually also want, I think like the last time, families and carers to be also immunising. There was an issue, we recall, last time. Quite a complex group of people to identify, but of course they were identified in the primary vaccination programme, so you know who they are. How long before you come to a position on perhaps recommending that happen? Are we talking about perhaps weeks?
Well, I think if you think about it, Fergal, in a way we're almost there, in the sense that already recommendations have been made for those 60 years and older. And in fact, you're absolutely right. If you look at hospitalisations across the board, it's over 60% of those people that have an underlying condition. And the same if you look into ICU, it goes up even more. So already, a lot of those people with underlying conditions that would increase the risk of severe outcome are being captured in those 60. And again, the main underlying condition that is associated, if you like, both with waning immunity and susceptibility and poor outcome is immune compromise. And advice has already been given for those. So yes, there are the others we consider, and that is in train, as with any of the groups that aren't yet recommended. We're thinking about the vaccines, who they're safe for, and so far the data is very good, but we know that we've been getting new information as time has gone along. For example, with the Moderna vaccine, we know now we don't need to give as big a dose as we did, and it was worth waiting to find that out, because of course there are some concerns, particularly if giving full dose to younger people, that we might increase the risk of rare side effects. So data like that is coming out all the time. That means that we can steer our path through this as safely as possible.
Thank you. Thanks, Fergal.
Hi, Louise Byrne from the Irish Daily Mail. Professor Butler, just another question on boosters. Are you able to set out a timeline for when people, say in their 50s or middle-aged people, will get their booster? We know immunity starts to wane after 5-6 months, and we're kind of coming up to that threshold now. So can you outline when people might be expecting to get their boosters?
Well, I think it's very important to look at what we mean by protection waning, because when we're talking about protection waning after 5 or 6 months, predominantly that's against infection, not necessarily against severe disease or hospitalisation. Then we have to look at who is at risk if they get a breakthrough infection at ending up with severe disease and hospitalisation. And predominantly that is age and immune status related or underlying conditions. So when you get down to a healthy 20-year-old or 25-year-old with no underlying condition, the waning that we've seen, which we are seeing in terms of the infections, is not translating into severe disease. And we know there's a differential benefit in terms of the vaccines and your immune response to them in protecting against upper respiratory infection, and actually the protection that protects you against severe disease, which is more sustained.
So do you know when people, 50,
well,
60?
Because we're looking at the data as it comes out and looking at the evidence of the vaccines. And of course, we want to give them when they're needed and when it's safe to do so.
Is it not a concern, though, that, you know, we're heading into Christmas, we're going to have increased socialisation again? I know we're saying cut back, but it's inevitable coming up to Christmas, we're going to have increased socialisation. So is there not a worry that people in their 50s, you know, who did get their vaccine 6 months ago are going to be more vulnerable?
Sorry, the people in their...
Say their 40s and their 50s.
Of course it is a concern, but for right now, we have to give the vaccines to those who are at the highest risk of a severe outcome. And as I say, that has been first the people aged 80 and older in the community and those in long-term care facilities. And now it's down to those 60, bearing in mind all those immunocompromised have been offered the vaccine. And so it will be.
So no timeline yet.
Could I just add to that, it shouldn't be understood that the vaccines are going to, or that boosting rather, is going to take the place of the kinds of measures that we think are going to be important for all of us to adhere to in terms of basic public health measures. It's not the message that people want to hear. It would be nice if you were able to say, get a vaccine and then you won't have to do all this other stuff. Unfortunately, that's not the reality. And so the measures that are going to protect people across the population over the course of the coming weeks as we head in, as you rightly say, to a period of time when socialisation, if anything, is likely to increase, given the time of year that it is for people to step up our collective adherence to the public health measures. And that's why we're advocating to people to cut their contacts in half. Look forward, think about what it is you're planning to do, cut your contacts in half. And if enough of us can get that message and change our behaviour, as I've said many times before, it doesn't require perfection. It doesn't require everybody all of the time. But if all of us are doing most of the things most of the time, we think we can change the small level of improvement in adherence that we know we need to turn around the levels of transmission.
I suppose in that vein as well, Dr. Houlihan, would you be encouraging companies or employers to perhaps cancel Christmas parties this year or hold them online?
I mean, these are all the kinds of things now that we all have within our control. Society is open. The guidance that's there across sectors does provide for things to happen. People can go to restaurants, they can go to pubs, it's appropriate for people to visit one another's houses and all of that kind of stuff. What we're looking for now is both individuals and, as you say, employers to make informed risk mitigation choices to try to minimise the risk for themselves, to minimise the risk, in the case of the question that you asked, for employees or for customers of particular services. And among the kinds of things we should all be thinking about is looking at the things that are discretionary. Do I need to do this now? Can I put this off? Do I need to attend a particular, am I going to go out to the pub 2 nights of the weekend, etc.? If each one of us can think about those kinds of activities and say, I'm going to cut those back, I'm going to reduce my contacts by half, and look at some of those kinds of activities that we're talking about, and maybe they don't all have to happen at the scale that might have been planned. Maybe they can be scaled back, and that'll be appropriate, let's say, informed, responsible decision making to be taken by individuals on their own behalf and on behalf of the people that they either employ or serve, rather than us or government making those decisions for you. We've been very clear about the kinds of things that constitute risk and the ways in which we can interrupt that risk and reduce the likelihood of transmission. And so the kinds of things that people should be aware of that are discretionary include some of the examples that you've given. And so we should all be mindful of that. We should all be thinking about, over the course of the coming weeks when transmission is so high, to take the opportunity to cut back our levels of socialisation. And I think the simple message we would have to try to cut your planned social contacts in half over the course of the coming weeks until we collectively as a society get ourselves into a better place in terms of transmission with this disease.
Thank you.
Thanks, Louise.
Hey Tony, Richard Chambers, Virgin Media News. Just in terms of antigen testing in primary schools, there was obviously a meeting between teachers' unions and the department today. what's your view on where things stand with antigen testing for close contacts in a primary school basis? Obviously, there's a lot of anxiety amongst teachers and parents about all of this. What's the current position?
Well, the anxiety we understand. We've been. We can see that in children of school-going age, we can see what the levels of incidence are. We still think that that incidence is attributable for the most part to transmission that's taking place outside of the school environment, not in the school environment. It's not to say that that transmission can't take place in a school environment, but in relative terms, we know that this is a lower risk environment, and that's all attributable to the work that's been done by schools, by parents, by teachers' organisations, boards of management, principals, and obviously the children themselves in schools adhering in a high level to the measures that are in place. But we have been looking in recent days at the most recent ECDC guidance and advice, and we're now just looking to try and see what's the most effective means of operationalising a very specific set of guidances that might apply to those that we might regard as close contacts in the school environment. That's not antigen testing across schools. We're not contemplating that. We have had engagements as late as yesterday evening. The two ministers and myself and some colleagues were involved in a meeting to plan, if you like, the implementation. And the HSE now is looking to see in the standard way. So I'm sure you're well familiar with the process. When we get new guidance and advice in relation to contact tracing, the HPSC puts a process in place where they incorporate that into revision of their contact tracing guidance and promulgates or disseminates that out through the system to the people who need to know. That's kind of where we are at the moment, and we hope to be in a position to complete that work in the coming days and to then communicate that. So that's being worked on. But it is not widespread antigen testing in schools as you might have seen in other countries.
Just in one of your answers there on the modelling, you said the new modelling would build in waning immunity as part of that. Do we have any data on that at this point in terms of what level of waning we are seeing at this
Well,
juncture?
that's for the models to now build in, and they'll build in the best assessments that we can make of that from the data that's published and the evidence that's available around that very question. And when we have the modelling, which I'm not going to commit that it'll be a particular date on Philip's behalf. He's not here. I know that work is happening and happening intensely to get us into that situation. So as soon as we reasonably can. I mean, at all stages through the pandemic, if we think there are important changes in terms of the assumptions that underlie the models, we make those changes. Just to take you back a little, you'll probably remember that some of the models that are in operation at the moment at different scenarios, depending on whether we regarded a child as having the same likelihood of transmitting the virus as an adult or having a lower likelihood of transmitting. And then other scenarios based on whether we saw ourselves socialising at a high level or socialising at a more moderate level, and looking at different scenarios then based on those assumptions. So in much the same way, what we're now going to do is update our current models, not with immunity staying at the same level all the way through from your second dose, but building in what we best understand around waning immunity from the published evidence, and we hope to have something on that in the near future.
Just one more from me, just in terms of Christmas 2021 versus Christmas 2020, in terms of what people do. Is it going to be quite like that? What was the experience last year in terms of people just being asked to, having Christmas out the back in some cases, outdoors? Is that sort of situation we're looking at this point in time?
No, I think the message for now is the simple message that I'm giving, that as we get into the winter period, and it's really more because of the high levels of transmission. Likelihood of you, if I can put it in crude terms, what's the chance of me when I'm out and about bumping into the virus? Well, right now it's very high, and what you need to do is, if you can cut down your social contacts by half, you reduce your chance of bumping into the virus, if I can put it that way, by half. And if we can do that across the population, we think that could have a significant effect in terms of transmission. Christmas 2020 last year was different to how Christmas 2021 will be. And a key difference is that we didn't have anybody vaccinated Christmas 2020. We have in excess of 90%, 93% of the target population now vaccinated, currently being boosted. And we're in a very different situation in terms of the impact that virus has as a result of the protective effect of vaccination. And that's what allows us to be in a situation where we're talking about maintaining so much of society open in a context where we have such high levels of disease transmitting, because we have such a high degree of protection. If we were looking at the ICU numbers that we have today, those people in ICU, we might have 2 to 3 times the number of people in ICU just based on the numbers of cases that we're notifying in the last 14 days. we might have 2 to 3 times the number of people being admitted to ICU every day. But it's the protective effect of vaccination that is the really key difference between the Christmas that we're yet to experience and the one we had last year.
Thank you very much.
Thanks, Richard.
Adam Higgins from the Irish Sun. Dr. Hoolan, Ireland play Portugal tomorrow in a sold-out Aviva Stadium at a time when we have about 3,000 cases a day. Have you any concern about tomorrow's game becoming some sort of a super spreader event, and have you any message to fans or advice?
The message to fans will be the message that we're giving in more general terms, that society is offering all sorts of opportunities for us now. Like, nothing is restricted or limited in the sense that you can't go. So things are open. So it's now up to you. What you can control is your decision to go to something. What you can control is how you behave and your adherence to the basic public health advice. So the message to fans will be to do their best, both individually and collectively, to adhere to the public health advice. A lot of work will be done by the FAI and the authorities that are involved in running that particular game, as is the case by the GAA and the RFU and every other sporting body, to try and make their events as safe as possible, and they have done very, very good work. It does then depend on the willingness and the commitment of people attending these events to maintain compliance with and adherence to the advice. A basic measure, that if you're thinking of going to one of these things and you're not vaccinated, you should stay away. I mean, people who are not vaccinated need to regard themselves as being at high risk of picking up this infection and the resultant impacts of that, particularly if they're in vulnerable groups. And while we've made great progress in terms of the numbers of people who are vaccinated, there are still some people out there who are vulnerable and who are not yet vaccinated.
On cutting down contacts as well, should people who are going to the match tomorrow maybe avoid seeing other people in the days after the game?
Well, it was one of the things that we spoke about last week. As you look forward, think about the kinds of activities you're involved in. If you're involved in something that you could regard as a high-risk event, where you're likely to be involved in crowds, where you're when we talked about nightclubs as the example last week, the thing to do is to not follow those up with other high-risk activities. If you know you're going to be interacting with vulnerable people, let's just say it's a scenario whereby you're planning to visit elderly people in your family in the days ahead. That's maybe something that you should think of putting off if you've been involved in a high-risk activity. That would be a responsible way of just looking ahead and thinking about how much of this kind of high-risk activity should I be undertaking. We know there's a portion of people out there in society who've probably, I won't say abandoned, but would be practicing not very much in the way of adherence to basic public health advice and involved in quite a high level of risk activity across lots of different sectors. And that's the kind of thing that we're concerned about, like following up one high-risk activity with another high-risk activity with such high levels of disease, with such a high level, high force of infection, carries a substantial risk to you of picking up this infection.
And Dr. De Gaskell, while we have you, is there any update on new variants of concern numbers in Ireland? Is there any other cases other than the Delta Plus?
No is the short answer. I suppose the most recent data on AY 4.2, which has been labelled Delta Plus, in some respects is probably more reassuring. No evidence of significant effect on vaccine response or on disease severity, and growth rate probably not dramatically greater than Delta, whom we've sequenced 106 cases to date. But there are a number of other Delta sublineages that are far more common here in Ireland at the moment.
Thank you.
Gabia Gatavsketa with the Irish Independent. Can I ask about, do we have data? I remember before the cyber attack, we used to get a lot of information as to where cases are actually coming from. So do we know now where the virus is actually spreading? If it's not in schools, where do we think the kids are picking it up? And if we're concerned about those high-risk activities, do we have evidence that shows that, for example, since the nightclubs were reopened, there's been a lot of cases and things like that?
So I think one of the points we've made throughout is that when incidence is particularly high like this, it's far beyond the capacity of our public health colleagues in the HSE, as it is beyond the capacity of any public health service across the world to contact trace the level of disease that we're seeing in the community. So our colleagues in the HSE at the moment are very focused on vulnerable groups, outbreaks in nursing homes, outbreaks in acute hospital settings, and amongst vulnerable groups. So We don't have the level of detail that you're looking for, however, in terms of a formal weekly report. And in fact, the HPSC themselves would agree that the weekly outbreaks report is not an accurate reflection of what's happening in the community. When you speak to public health doctors on the ground, what they're telling us is that if you take Leitrim, for example, Leitrim is a particularly high incidence at the moment. When you speak to public health doctors there, what they're saying is that it's not one thing. This won't come as a surprise to anyone, but it's just a whole range of different transmission patterns across the community. It's workplaces, it's social gatherings, weddings, it's outbreaks amongst vulnerable groups, it's socialisation, and it's our public health colleagues in the HSE who are telling us that it's socialisation outside of school settings in children, that they're not seeing significant transmission happening in the school environment. So there isn't one simple answer, unfortunately. There's been times during the pandemic when we could readily point to, for example, meat processing facilities or some such setting. That's not the case at the moment. And the reality is at the moment that you're probably at higher risk today in any given situation of being in the company of an infectious person than at any point during the pandemic to date. And from that perspective, we know that people understand that there are higher risk environments and lower risk environments. So people understand that if they're in crowded, poorly ventilated indoor settings, that's a high risk environment. We understand that we know that people understand that the more people they meet, the higher their risk. But what keeps coming across in the data is that people have disregarded the importance of the mitigation measures that they can take at an individual level. So the importance of mask wearing, the importance of keeping distance, the importance of meeting up outdoors rather than indoors. And then the other piece of data that's coming through is that people, again, are assuming that if they know the people they're coming into contact with, that those people pose less of a risk to them. And unfortunately, that's simply not the case. So when we talk about these mitigation measures, it's very important that people keep them up even when they're meeting family, friends, people they're familiar with.
Can I also ask about COVID passes? Would you be in favour of extending them to places like, for example, gyms or hairdressers like other countries have done?
And we look at that on an ongoing basis. Is this on? Yeah, okay. We look at that on an ongoing basis. I mean, and we have extended the use ahead of many other countries into other sectors of the use of those. There's nothing to stop organisations, as part of a responsible set of measures, requiring that, like as part of their activities, whatever they may be, that they'll seek to protect the customers or the staff or the members or whatever it may be of that organisation by applying that as well as other measures in an attempt to try and protect people from transmission. So yeah, of course we'd be in favour of the more we can see assurance around measures in place in different settings, the better. But you can see that in many situations where the COVID pass is already a requirement and has been so for some time, not only are we seeing not compliance as high as we would like, but we see evidence that it's actually slipped over time in some of the sectors, and as Dr. Glynn showed in some of the slides that we showed you earlier on, and that is a concern. And that we'd like to see is that more and more, and I don't want to overly focus on pubs because we're not just talking about COVID passes and so on applying to that particular environment, but the more and more we can see that being applied, the greater the assurance we have around protection and transmission. I mean, we need to see the kinds of environments we're in and judge the risk on the basis of the conspicuous things that we see. So what I mean is if you're going into a pub or you're going into some environment where you should be asked about the COVID pass and you should be asked to present your ID, you should be concerned that maybe other things that need to be in place in terms of your risk are not in place, in much the same way as that if you went into a restaurant, for example, and you visited the toilets and they were dirty, you'd probably have a question in your mind about what the standards were like in the kitchen. We need to similarly think about, well, look, if I can see that I'm not being asked as I go in to this environment for my COVID pass, maybe this isn't the safest place for me and I need to take my business elsewhere. And we've said before, it's difficult for Irish people sometimes to complain, but you can certainly take your business elsewhere, and no more than any other business, if there is a demand from consumers, as there should be, around making the environment as safe as possible, then we might see some improved performance, at least in parts of the economy and society where we know compliance isn't as high as it should be.
But you are in favour of COVID passes being extended to places like gyms and hairdressers?
And we look at all of that on an ongoing basis, and we'll give advice on that if we think that's appropriate. But yes, we'd have no reason to have any concern about that, and nothing to stop people in those sectors saying that's an additional security and safety measure that I can put in place to protect my staff, to protect my customers. That would be a good thing.
Can I just pick up on something that you said to Richard there about antigen testing in schools? You said that you're not contemplating it across schools. What does that mean? Can I just check what that means?
So the ECDC guidance is about in certain epidemiological situations. So in other words, if there's a concern at a particular point in time about transmission in a particular school environment, we want to say, well, what might those criteria be? And in that particular setting, individuals might be identified as a close contact, and then will be tested in much the same way as we've provided for testing of close contacts in the household environment. So that's really all we're doing, is to say there might be a situation whereby the idea that we test close contacts that arise in a household environment with antigen testing on a periodic basis, but we don't restrict their movements, that there might be certain situations in which a similar sort of arrangement could arise in a school environment. We're looking into what those arrangements might be. It's not the widespread application of testing of all school children prior to attending school twice a week, etc., as has existed in other jurisdictions. This is something that would be focused you could look at it as an outbreak type response. So a problem that has arisen with the disease would be responded to by the application of guidance around the use of contact testing.
And then obviously if you have that testing in place, you obviously need contact tracing as well. So that means that contact tracing is going to come back into schools.
No, what we're saying is that, like, in the first instance, we want to see antigen testing, and then we'll have clear guidance and advice as to what that means in terms of contact tracing. We'll set all that out when any change or update in terms of contact tracing is finalised in the work that the HC is doing, and the HC is doing that work with the Department of Education as we speak.
Okay, thank you.
Thanks, Gabby.
Oh, hi, Niamh Griffin from the Irish Examiner. Just first to carry on maybe from Gabby's point, the HSE said that they have no shortage of antigen tests, that they're ready to do it if asked. Are you in contact with other jurisdictions, maybe Northern Ireland, to see their experience of antigen testing in schools?
Well, we're in contact, as you know, with Northern Ireland on a regular basis. We meet the team, Michael McBride and his counterparts, on a fortnightly basis. We go through all of their measures. There have been different practices in place in different time periods. We look in general terms, we're talking about guidance in this space, to the guidance that's provided by the ECDC, and that's what we're looking to do now, is to try to incorporate ECDC guidance, the most recent, into the updated practice that might inform how we might provide for antigen testing in specific settings in the school environment. And it'll be a highly specific set of settings as opposed to widespread generalised use, which was the situation in other countries. And also bear in mind...
Why have you decided on that approach?
Pardon me?
Why have you decided on that approach?
Because we're following the ECDC guidance.
Okay, the ECDC guidance, though, also talks about the risk of in-school transmission remaining high, and they go through different types of contact tracing and antigen testing. It seemed quite broader than what you're saying here.
But don't forget, the ECDC guidance is directed to all of the member states of the European Union, where a whole variety of things will be different between different countries. The arrangements that are in place in this country in terms of protections around schools, and we've seen this in the past, a very, very high standard of measures in place to try and limit transmission to the school environment. And we know on the data that we've had in terms of our experience here around transmission, and in particular if you go back to September and what was our experience, where we had a very significant surge in testing after the resumption of the school year in the 5 to 12-year-olds and primary school children in particular. There was an increase in incidence that was detected by that, but the positivity rate was significantly reduced. And what that meant is that it wasn't an increase in the underlying transmission or incidence rate among children, just a change in the likelihood of picking up a given case. And all of that then, when that dropped back down when the levels of testing reduced in line with the reduction in incidence across the population, and gives us assurance that we think the school environment is still, in relative terms, a place of low risk in terms of transmission because of the measures we have in place in this country. but we're contemplating now the updated guidance, and when that's completed, and that work I think will be completed very soon, the standard arrangements we put in place to try and ensure that it's appropriately implemented.
I think just from speaking again with colleagues in public health and the HSE, a key part of that guidance will be setting out very clearly and communicating where antigen tests are not appropriate and what they're not expected to do. So ultimately, the core message is and will remain to parents and to school authorities that any child with a symptom suggestive of COVID-19 should not be going into school. They need to stay at home and they need to get PCR tested. And that will have a knock-on impact in terms of reducing RSV infections amongst younger children. It'll reduce the spread of COVID in schools, and it'll also have an impact on reducing the spread of influenza over the coming weeks when that becomes more of an issue in this country. And then the second key message that will come out, I think, as part of that guidance is that testing obviously has played a key role across various settings, and we continue to evolve our testing strategy. But testing has never, ever, and never will be a replacement for the core IPC measures, infection prevention and control measures that are in place in various settings. And I think one of the best examples of that over the course of the pandemic has been the work done by the education sector and by schools, by teachers, by parents, working together to make sure that schools are not the high-risk environments that ECDC talks about in the absence of those mitigation measures, and to ensure that those measures are in place and are keeping children safe. But ultimately, yes, there will be a limited role for antigen testing, but the key message in all of that is that parents in particular should not be using antigen testing as a green light test if their children have symptoms. And we have evidence that that is happening in cases across the country. We have children going into schools who've been antigen tested. The antigen test says they don't have COVID, and unfortunately they're sitting in the school environment with COVID. So we need to be, it's a challenge, but we need to be very clear in our messaging around all of the interventions that we use in this pandemic.
Okay, thank you. And just one more question on the Department of Health has advised its workforce to work from home where possible. Is there any change to the advice for the wider population?
Well, we're giving ongoing consideration to what advice we'd provide in the first instance to government. As you know, we have, or you may know, another meeting of the National Public Health Emergency Team tomorrow. And we will, as we do on an ongoing basis, consider are there additional or further measures that we might recommend across the board. And I'm sure among the considerations that we'll have will be that. But yes, this department has taken that leadership step, leading by example, to say, look, we think that it's appropriate and safer for us to reinstate our working from home policy fully. Although we had made arrangements to enable people to come back into the workplace because we think the levels of transmission now are simply too high. We're also mindful of the most recent thinking, if you like, that's been published in relation to this, and in particular some of the work that's been published by SAGE in the UK that you'll be aware of, that did talk about the workplace and measures that might happen around the workplace, and to reduce the risk of transmission around the workplace, and to focus on strengthening work from home mandates as a key next measure in the event that countries needed to, and in their case the UK obviously, but in the event that they needed to rely on further measures to augment the measures that were in place there. So we'll be looking at all of that.
Considered tomorrow.
I mean, all
as
of these
one
things,
option.
Yeah,
okay.
Exactly, yeah.
Okay, thank you.
Ronan Duffy from the Journal. Just to follow up on discussion there in relation to antigen testing, and you mentioned that we can expect some guidance about the areas where they can be used, or perhaps where they shouldn't be used. Will that include, I suppose, some kind of explanatory videos or whatever about how exactly to use them correctly? Because I know that's been a concern from NPHET, and I haven't seen personally the information out there from the Department of Health about how exactly it can be used. Is that something we can expect, and do you think it's helpful?
The HSE has developed information materials already in relation to how to use antigen testing. That's all on the HSE website, and obviously if there's further materials required for children, obviously that will be developed over the coming while in line with the guidance.
Yeah, I wasn't speaking directly about children. I was kind of speaking more anecdotally about, there is kind of a broader use of antigen testing. I know people, for example, who have had a positive test and have gone for PCR, so it is already playing a role. I'm just wondering, would it be a more prominent, visible role in terms of videos from the Department of Health? Because I've seen NHS videos, but not Irish ones.
Well, so a core concern that we've had throughout in relation to antigen testing is that symptomatic people would use them, would get a false negative result, and then would not go forward for PCR testing. We know that many people are using them when they're symptomatic, and on the one hand, that's okay if it's positive, and then you go forward and get a PCR test and you isolate all along that pathway. But unfortunately, many people will take the negative test as definitive evidence that they don't have COVID. And we know from work that we did in August that about 1 in 3 people thought that using antigen testing was a quick way to find out whether they had COVID or not if they had symptoms, and that's simply not the case. So to your question, do we need to do more comms around this if we're going to roll this out more widely? Certainly we do. And I think as a community of clinicians and scientists, we need to focus now on ensuring that people understand when and when not to use antigen testing, as opposed to whether people should or should not use antigen testing. So how to use them, when to use them, how to interpret the result, which is very important, and what to do in the event that the result is positive or negative and what that means.
Okay, and just a question for Professor Butler. In the summer, it was a couple of times the interval between AstraZeneca doses was reduced, and there was a period where perhaps there were people who had a first dose of AstraZeneca were perhaps worried that they hadn't got that second inoculation. Do they still now have to wait 6 months to get the booster jab? Because I know there's been people who perhaps were in vulnerable groups were given AstraZeneca. Should they still wait 6 months until they get the booster? What's the advice for people in that situation?
At the moment, the authorisation in terms of the booster dose is for about 6 months after they had received the vaccination, and what we've recommended is that in some cases that might be reduced to 5 months on a practical basis. There's no real reason in terms of the AstraZeneca that they should get it at a shorter interval than, for example, the Pfizer or the Moderna vaccines. So that's the general recommendation for now.
Paul Cullen from the Irish Times. Just to follow up on that, it was a similar question I have for you, Professor Butler, which was to tease out some of the issues around specific vaccines. My colleague mentioned AstraZeneca, and I have had correspondence from people who have received AstraZeneca in late June, which means that they can't get boosted until after Christmas, and they're wondering, do they have to lock themselves away for Christmas because of that? Also, you'll be aware of some studies which point to alarmingly high levels of waning immunity around Johnson & Johnson. And some countries on both sides of the Atlantic are telling people to get boosters within 1 or 2 months. So have you addressed those issues, and have you any comfort to give people, the 250,000 people who got Johnson & Johnson, I think it's about 500,000 or more who got AstraZeneca, who might have concerns in that regard?
Well, I think the comfort I can give people, Paul, is that they are all the issues and the considerations that we are aware of and take into account in terms of the recommendations. And the first issue was to make sure that those that were most at risk of having a severe outcome would get their booster doses. And any of the other issues are under review, and they are taken into account with the recommendations as they are made. And you're absolutely right, we take into account the time lapses, we also take into account the different vaccines, and we take into account the stepwise risk by age that is associated for those who have breakthrough infections ending up with a more severe outcome or hospitalisation.
Okay, I'll just make an observation. It's hard to understand how somebody working in a storeroom in a pharmacy is at more risk than the people we were talking about earlier with chronic illnesses. You know, so while that blanket answer is given all the time, and this was an issue that was raised in the first vaccine rollout, you'd think now, by the time we're coming around again, that we would have refined the process to ensure that there is an absolute and correct ordering and priority of people.
In terms of the comorbidities, in terms of the data, the main risks there are in terms of the over 65 age group. It's quite difficult to tease it out below that, but we know that even of the younger age groups, for those who end up in hospital, they are more likely to have comorbidity, and those are the issues that we are aware of and take into account in making the recommendations.
Okay. Dr. Hoolan, can I just ask what else is on the agenda for tomorrow's meeting?
We have just a general update in terms of just where we are, a standard situational update. We'll be looking at not just the situation here, but the situation in other countries, looking at some of the new updated data that Dr. Glynn has shared with you, including some of the data we've seen the ESRI has published through SAM and CSO has published in relation to different workplaces and work settings and the experience of infection in those settings and incidence rates and so on. We'll also be obviously keeping an eye on what guidance has been published through ECDC and WHO, and we'll give specific consideration, as we always do, to the general question of what other measures might we contemplate or need to think about. That's not a new question, that's the standard question we ask of ourselves every time. Do we stick as we are? Are we doing everything we need to be doing? Is there more that we could be doing? And what form might that take? And we'll see where that discussion brings us. And in the first instance, obviously, as you're well aware, a letter will issue to the Minister containing the advice, and he'll bring that then through the decision-making process.
Okay, just finally, there was some speculation in the autumn that NPHET was to be wound up and would cease to exist in its current form, at least. What's your understanding about your current position? What have you been given to understand by the Department or the Minister about your future role in the pandemic? And has that changed as a result of the recent rise in cases?
I don't mean this to sound like a flippant answer. I mean, there was some speculation in the same time period that we were going to see the demise of the virus as well, and that unfortunately hasn't proven to be the case. We find ourselves in a situation where we're still challenged by the challenge that's been posed all the way through with this virus. It has evolved, it's changed. We have high levels of vaccination, but we have the question about waning immunity. And we have right now, a population that's been dealing with restrictions of one kind or another for 18 months, and so the challenge of how you actually implement measures that can affect transmission in that environment. So in many ways, a more complicated situation now than you could argue, than many of the times that we faced over the course of the last 18, 20 months. The mechanism that we've had in place to guide us all the way through in terms of advice through the Minister to Government has been this mechanism. And unfortunately, the virus and the pandemic hasn't finished and hasn't brought us to a point where we can step away from having those kinds of emergency-related measures in place, and that's why it continues in place. And as I've said before in public, when we get to a point in relation to this particular pandemic that we think that those risks have changed and this becomes more and more part of something that we deal with, then we'll look at all of the governance arrangements, and it won't just be here. NPHET, it'll be things like the COVID Oversight Group, which remains in place. Similarly, wasn't envisaged to have a continuing role if the pandemic had taken a different course. And we'll step those back. My role, Ronan's role, Killian's role, Karina's role in relation to these kinds of issues will always continue. So even if we haven't an NPHET structure, we'll be continuing to do what we do in relation to infectious diseases across the board. But the NPHET structure, which has guided us in terms of advice, multidisciplinary advice from a whole range of different disciplines, we believe we still need and are not at this point in time able to identify the point at which that will be no longer necessary.
Just for the point of clarity, though, was the reporting in the autumn inaccurate or at least premature in saying that NPHET was going to be wound up? And a specific date was mentioned at the end of October, I think.
Well, I'm not going to say it was premature. I mean, if and I'm not sure if you're referring to a specific perspective that somebody might have offered at a point in time. I'm sure that person was hoping that this infection would be in a different place, just as I was, just as we all were, and that we would be in a position where we could go back, if I can put it in these terms, more to our day jobs, to do the kinds of things that we want to be doing, and not just solely focused on COVID and the challenges this pandemic has thrown up for us and for the country. And unfortunately, the situation we find ourselves in is that the viral transmission patterns hasn't allowed us to do that.
Thank you.
Thanks.
Dr. Hoolan, has your opinion changed whatsoever on the possibility of reintroducing restrictions?
No, in the sense that, restrictions, if we think they're needed, will always be something that we'll give contemplation to, and if we think they have a role to play in whatever form. And I mean, the word restrictions is a broad word. If by that you mean the closure of economic and social activities, the closure of certain sectors or segments of society. Nobody is ruling out things like that anywhere, but at the same time, no one has an expectation that we're going to go back into that kind of environment. We're not planning and contemplating on that basis at this point in time. There are one or two countries, I think, across Europe in particular, maybe Eastern Europe, that are beginning to contemplate the reintroduction of some measures. But it's because of an alarming increase, not only in transmission, but because of their low levels of vaccination, the impact that's having on hospital environments. There are some countries that are in a really disastrous position, is the only way you could describe it, in terms of the impact on hospitals and the impact on public health of high transmission in low vaccination uptake rates. And they may be forced into thinking about some of these, a return to some of these crude measures. We're not in that situation as a country. We have a very high level of vaccination. And although we have high levels of transmission and we're seeing translation of that into hospitalisation and ICU admission, it's not nearly the kind of situation that other countries that are being forced back down this road are in. And it's why we think there's still a middle ground, if I can put it that way, that we need to focus on redoubling our collective efforts on the basic public health guidelines, on the things that we know have worked in the past, on getting people boosted, particularly those who are in the vulnerable groups that Professor Butler has spoken about, and ensuring and encouraging and, where necessary, enforcing higher levels of compliance in the sectors in which people are unable to interact, to try and make those environments for all of us as safe as they possibly can be. But our basic message for individuals now at these high levels of transmission are for each of us to try and cut our social contacts in half while maintaining a high level of compliance with all of the other measures. And if we can get that message out collectively, we think we can have some impact on transmission.
Yeah, but you have been trying to get that message out for weeks now, and obviously people aren't listening. And all that being said, with respect, you've said that there are not encouraging signs of a reduction in socialisation. So where do we go from here then? If you don't get the public buy-in and people aren't listening, where do we go? Well,
a lot of people are listening, but maybe just not enough. So we still see a high level of compliance on the part of certain sectors of society. We know that worry and concern levels, which are closely correlated to behaviour, has changed somewhat in some of the segments of the population. And the point that we make is around transmission, particularly when we have such a high level of a force of infection, a very small change in terms of our collective contact behaviour can produce a very, very big effect in terms of increase in transmission. And so you're right to say that, like, we haven't seen, I can't point you to, there's the data that shows that we've turned a corner now in terms of socialism. I can't point to that data at this point in time. I'm still not expressing hopelessness in terms of that as something that could come. And if it does come, we think that we would see a significant change in terms of transmission. And that's why we keep emphasising those basic measures for individuals, for sectors, to take on to themselves responsibility for implementing, adhering in as much as possible to this basic guidance, so we don't find ourselves in a situation that other countries have simply been, a small number that, albeit, look like they're now being forced into by the very significant effects that their high levels of transmission are having on their, in particular, hospitalisation rates and ICU admission rates.
What other sectors of society would NPHET be in favour of organisations implementing the use of a vaccine pass? I know there's mention of gyms and hairdressers there.
To be honest, it's a basic safety measure. The more we can see it being applied, the safer the environments that individuals find themselves in will be. And there's nothing to stop, as I've said, organisations, and there are many organisations that are not, in a sense, controlled by government clubs and various other social organisations. And the more we can use these kinds of protective measures, but it's not just about COVID passes. I mean, one of the things that I think we need to keep reminding ourselves of is that there isn't a single solution to all this, as Dr. Glynn was saying earlier on. It's lots of different forms of socialisation all coming together to create this risk. So the kinds of things that are going to work is going to be lots of different. So it's not about just whether you had a booster or not, just whether you had a PCR test or an antigen test or not. It's not just about one particular part of it's about how the whole lot of it comes together to influence your risk. But the key measure that you can take as an individual is making that basic assessment about your own risks, planning a little forward and trying to reduce your levels of social contact, and in particular the symptomatic cases we keep emphasising. If you have symptoms, you cannot and should not be out socialising, going to college, into the workplace, etc.
And just lastly, Dr. Glynn, I think you mentioned in your introductory remarks about stabilisation in hospitals. Has that changed now? Because we've heard in the last couple of days, cabinet ministers are out saying that the ICU numbers and the numbers in hospitals were stable. So is that no longer the case?
So there was a transient stabilisation at the end of last week, and the numbers seem to be dropping slightly, but unfortunately it does appear to have been transient and it's gone back up again in the last 48 hours. So, but there's uncertainty around that. There's uncertainty around the case numbers. And I suppose the key point we want to get across is that we can't give any comfort that either the case numbers or the numbers in hospital or ICU will turn in a positive sense over the weeks ahead. And ultimately that's dependent on what we do as individuals, what organisations, workplaces, etc., do. Just again to look at it's the basic measures that make all the difference. It's very small changes will make a huge difference at a population level. And I know we've said that for the last 18 months and people are tired of hearing it, but it's as important now as it ever has been.